Everybody, welcome back to the channel. It's Dr. Jonathan Perlman from Paramount Chiropractic Wellness. Today's video, I'm going to cut right to the chase. Oftentimes, you'll see these amazing, cracking, loud-sounding, cool chiropractic videos. They're very satisfying, is what a lot of people will say to me. And I understand the satisfaction that somebody could get out of seeing that type of pressure release. It's actually built within our innate intelligence. It's something we talk a lot about in chiropractic. It's in our innate being to know that that cracking, that gas relieving in a joint that also causes this great pressure exchange, this pressure gradient change, the quality within the joints of the spine and the way it stimulates the brain, and how we can actually inhibit pain and increase range of motion, and a little bit, and so much more than that, within a chiropractic adjustment can be so effective. Now that effectiveness is something that you can expect on a high level every now and again. But that's the importance and why I made this video, is for you to understand out there as a consumer that a lot of times what it is a trial of care that people will undertake. Whether it's 6 visits, whether it's 12 visits, whether it's, months of care, whatever it may be, depending on somebody's individual situation, one adjustment can oftentimes be the difference between no pain for months versus, I got a little bit of pain relief for about a few hours. Again, it's all case dependent and on the individual and their unique physiology, anatomy, neurology, and everything associated with the type of pain that they have. So what I want to do is dive into a particular case study to kind of showcase why it takes time and why oftentimes it will be very underwhelming early on in chiropractic. And then as you go on through the trial of care, you begin to feel some of the amazing effects that people talk about when we use terms loosely like, oh, we got great results, or somebody somewhere got great results. That's such a generic, kind of cliche thing to say almost, in my opinion, that I really want to showcase how people will get these results. Now I'm going to jump into this case study. I want everyone to appreciate this spine here. And this is somebody that came to us after a football-heavy career, played from pee-wee when they were, just a child, through high school, through college, and then well into the semi-pro and arena football professional level. And this person's spine, as you can see, at least from here, doesn't look like much going on. And then when it curves over to the right here at the end, you have something that are called lateral claw osteophytes or bone spurs on the outside right here, and a very great amount of degeneration at L3, L4, L5 on top of the sacrum. We look at this person's x-ray, and in the Gonstead system, we use our line analysis to see what's going on. Now, this is not a lesson about Gonstead line analysis. I want you to appreciate that I have a 277 millimeter measurement from here down to the bottom of the ischium. And I have a 273 millimeter difference, the marking is down here now, again from the top of the ilium down to the ischium. I have a line that goes down the middle where we can see that there's rotation, what is actually external rotation of this left pelvis going this way. And you can see that the spinous processes of L5 and S1 also shift this way. 4 millimeters of rotation on the sacrum. So what I'm doing is I'm pointing out the significance of all these shifts in his pelvis. Now, it's normal for people to have a shift in the pelvis. It's not necessarily normal, but it is significant to have this amount of degeneration and these osteophytes and these bone fragments that are so close together, bothering the disc and the nerve root itself that then runs down the leg and causes symptoms like sciatica, or what's also known as radiculopathy. So what I want to point out is, and the reason that you have to undergo this trial of care is, if you looked at this, and as a doctor practicing, whether it's chiropractic, orthopedics, whatever, like a healthcare professional, we would maybe get an MRI at some point, or maybe they've had one previously, as an example, and say, well, look at that L5-S1 disc. Clearly, that's where we need to work. Clearly, that's what we have to correct. In some cases, doctors will say that's what we need to operate on. But in this particular case, if we look at the pelvic unleveling and foundation instability, we've got to fix that. We have to address it. Because whether or not we make only a couple of millimeters of change in terms of a static, functional, foundational correction, it's actually the neurology that likes the motion going in the proper biomechanical direction, creating neuron and synapse, these neuronal patterns, okay? Kinesthetic sense, that's a real thing, proprioception, awareness of oneself in space, and proper biomechanics that's actually registered by the brain. That's why proper range of motion is so critical in terms of rehabilitation, because it's actually training the brain to understand pain-free, proper range of motion. So, in the words of Gonstead, the system that we practice, and why I've kind of referred to it, myself as either a Gonstead chiropractor, or if you heard about us saying we practice the Gonstead system, Clarence Gonstead used to say, the bone's not ready for setting. Hence, the trial of care. If I can't correct this foundation, I'll never be able to correct the fourth or the fifth lumbar, if that's where the subluxation is. If that subluxation is so bad and I can never get the pressure off the disc at L4 or L5, I'll never be able to get set up on the pelvis in order to make the correction on the pelvis that I need. So doctor, are you saying you need to know where to start and which way the biomechanics go and how I can make a specific correction, and then once you finally correct it, it will be corrected? That depends. I have had people come in here where I have their x-rays and guess right, and we correct their pelvis and then their lumbar, and I never see them again. And when I finally get a chance to catch up to them, or I reach out and say, hey, haven't seen you, is everything going okay? They're like, oh yeah, thanks for everything you did, haven't had pain for a year. It happens. Other times, I might have to adjust somebody 12 times over a 2-month period, and finally they're stable because we've transitioned them from that passive chiropractic therapy to an active exercise, core stability type of therapy where they can do things like reverse hyperextensions, where they can do things like cat-cow comfortably at home, where we can get them to be able to control rolling their psoas, and every now and again coming in for an adjustment. Other people might have degeneration so bad that it actually takes a real, proper, longer trial of care and then maintenance care for, yes, the rest of their lives. This is a real thing that happens, which brings me to case number 2 that I want to share with you. So, this lateral lumbar is a 40-some-odd-year-old female who had horrific neck pain a long time ago. And yes, this is a lumbar view. She actually had surgery on her neck, her lower cervicals, C5, 6, 7, and they're fused now. But when she woke up from surgery, she had terrible burning pain down her left leg. Now, there's a lot of neurology I can go into about the anterior part of the spinal column up around the neck, and how the most anterior portion in certain areas of the spinal cord actually have a lot to do with the distal extremity flexors and or extensors, depending on where it's pushing on the cord. But that would be an awful lot of pressure. And for example, if you know somebody who's in a car accident, they break their neck and become a paraplegic or a quadriplegic, or those types of devastating injuries, why is it that they can't use their lower limbs anymore when they broke their neck, right? Or they've had a spinal cord injury in their neck. Obviously, there's a connection between the spinal cord very, up high and the down low functioning distal extremities. Excuse me for stuttering. So what we have here now is L3, L4, and L5. As you can appreciate, unbelievably well-maintained discs, 40-something-year-old female, healthy otherwise, very good disc space. But if we come down to L5S1, and I hope you can appreciate, there is no space left down there. That is almost virtually bone-on-bone fusion, including calcification within the disc. So there is a lot of damage going on at that L5S1 disc. Why it showed up after surgery, we can go into a million reasons why this person felt the burning pain when they woke up from surgery. But here's the important thing to note. Their AP view over here, we can actually see that this person has a nice, what we would call radiolucent, radio-opaque, the whiteness of the opacity cut out perfectly. Well, this patient had a laminectomy on their lower L5S1 region to reduce pressure from the spinal cord after a year of talking about this burning left-sided pain, to which there was no resolution. I'm not knocking the surgeon here. Simply put, this was an ineffective way to treat this person's pain. By doing the lightest of adjustments, just really pumping the area and doing manual light decompression by hand and other small adjustments throughout the spine, we were able to get almost, I'm going to just pick a number right now based on communicating with my patient over the last 4 weeks, within the first week and a half, near 85% resolution in all symptoms, meaning they still feel a tingle, they still feel a warm sensation from time to time in the foot and outside of the leg, but the burning, shearing, just awful feeling that they've had for years is now under control. This person will likely have to have chiropractic on a fairly frequent basis for the rest of their lives. That's going to be up to them and for me to manage and make suggestions and ultimately be their choice how often, what the frequency of care will be for the remainder of their life based on how we can change the sensitization or how we can change the sensation of what the nerve root is feeling at that level, because just by working, again, very lightly in this area, super safe, they have had, again, about 85% of resolution in symptoms. The first person we showed you as well, who's a football player, has also done amazing over a 2-week period of care. My goal for him, which is complete opposite of this particular person, is get to a point where they are much more functional to be able to modify and take care of their spine, modify their workout routine to take care of their spine a little bit more independently, where I adjust them maybe once every couple of weeks to once a month as needed, where somebody like this might need a ton of chiropractic care. And this was all in a roundabout way to say, if you see a chiropractic video and it looked like the most satisfying, relieving, cathartic thing you could have ever seen in your life, it very well may have been. But oftentimes those revolve around trials of care, and that you should never, in particular because we get a lot of people that drive great distances for the Gonstead technique, and I'm just want to put it out there on 100% transparency, oftentimes you are going to need a trial of care. Even if we did everything right the first day and everything went perfectly, you would really be in the minority to think that that one adjustment changed your life in terms of reducing that pain forever. So, I am standing here legitimately today as living proof that chiropractic can do things that are often called miracles, but what they are is they're scientifically proven, applied procedures based on anatomy, biomechanics, physiology, neurology, and people's ability to adapt. And then there's no really and then. People's ability to adapt. And through trials of care, we can oftentimes really, see that people's lives are changed for the better. And that's what I want to put out there. Adjusting videos, if they're done in great taste, I have no problem with them. I will do them as long as I'm in practice. I think they're fun. I know they get a lot of views and clicks, and that's what we want, right? We're out there promoting ourselves, we're promoting our brand, and based on today's the accessibility of social media, that is a good thing. But as consumers and people looking to reap all the benefits of chiropractic, I think that you really need to understand, and I hope that this video brought value, and I know it's long, hopefully I've been able to edit this down enough. Buyer beware, always expect to be sold a trial of care. Hey, didn't even know I was going to make a rhyme. But guys, if you ever need anything, feel free to leave a comment, like, subscribe, share, all that cool stuff. It'll help us help more people. Really appreciate you. If you ever need anything, it's Dr. Perlman.